bad, my all real. I riding, it's a big tall hills, big fat checks, big large bills. Burn out flip like 10 car wheels. Hold that, give Ross chills. 10 different looks and my looks so kill. I kiss him in the mouth, I feel all grills. Heat in the car, that's your song bills.
Hey dolls, welcome back to my channel. This is for me day 18 post-op. I'm gonna show y'all what I look like. I have on my garment, my FAJA from look at that. I got this from Amazon while I'm waiting for my contour FAJA to come. It's pretty good with compression. I have pulse pads going around my tummy tuck scar to protect that. And right now I don't have any lipo foams on it. We're not here today to talk about day 18. We're here to talk about the most requested video, and that is how much that surgery actually costs in the Dominican Republic. So I kept my notes and I have a lot of information on that, and I'm gonna go over how to get in touch with my plastic surgeon and what the process was. Okay, so like I said in my last couple videos, that Medina was my first choice from the beginning. After I did all my research in 2016 while I was losing weight after my gastric sleeve, she was always my first choice, so I went back with her. And to get in touch with Dr. Medina, I found her on Instagram. One sec, gotta get my phone, and that is rude. I wrote it down, but I want to make sure I give you guys the correct Instagram. Okay, so if you want to follow her on Instagram, it's Dra Tania Medina, and that's her Instagram. Let it focus. So this is the Instagram I've been following since 2016. On the Instagram, it gives you her WhatsApp number, which is 1-809-917-1586. And if you see me looking down, it's because I am actually looking at my notes here. Okay, so I'm gonna go over my first quote that I ever got from Medina and how things changed up until 2019. So I reached out to her in 2017, actually. This is my quote from Wednesday, July 5th, 2017. I sent her pictures via WhatsApp. All my pictures, my front, they're going to request that you send pictures of the front of your body, back, side, whatnot. Okay, so she responded. She said, I think I can do a very good job to improve your figure so you can be the best version of you. She said, after I've seen your pictures, I understand I can improve your body with the following interventions. So she said that I would need a tummy tuck with muscle repair, liposuction on the waist, liposuction on the lower back, liposuction on the upper back, liposuction on the flanks, which is on your back as well. And they said, and then she said, with or without liposuction to your buttock, which is the BBL. The price is the same, with or without the BBL. So you can pretty much wake up and don't have a BBL, y'all. I was praying I woke up. I didn't care if I got a BBL because I already had a big butt. I just wanted to wake up and my butt was like contoured and matched my new hips and my waist. But anyway, so the price then was $4,500. Cool. I'm like, oh, that's lit, because I had looked at different surgeons here in Atlanta and I was seeing like 18,000, 11,000. So $4,500 US dollars, that's lit. And then it said if you need a recovery house and transportation, the recovery house will be included. It's a shared room with all the meals, a nurse 24/7, air conditioning, and Wi-Fi. That was $75 per night. For 10 nights, it was $750. Okay? And then it said transportation is included, the airport pickup, medical checkup, and bring you back to the airport. That was $100 US dollars. So the total price with the recovery house and transportation was $5,350. And if you wanted any extra areas of lipo, it would be $300 each. You have to have primary lipo first. Okay, so it also went on to say if you needed a blood transfusion after surgery, it was $200 per bag. Most of the patient need 2 bags, and I needed 2 bags, so we're gonna talk about that. And that's US dollars. And then if you needed to stay at the clinic any extra days, if you had any complications, that's $200 more. Any extra areas will depend on your hemoglobin levels. I was supposed to get my inner thighs done, but because my hemo had dropped so low, which I don't even know how they knew that. Maybe they have a way to check that while you're on the table. I didn't get my inner thighs done. But if you want both of your arms done, it was $300. Your inner thighs is $300. Posterior thighs is $300. Anterior thighs is $300. Lateral thighs, $300. Armpits, which she actually did, and I didn't ask her. My armpits are done. So I'm thinking, y'all, she may have got it mixed up because we didn't talk about it in our pre-op appointment. I talked about it with her assistant, and maybe she got it mixed up. I wanted my inner thighs done, I got my armpits done. And that's cool with me. Now I'm not gonna have that fat hanging over here. But anyway, armpits was $300. Your chin area, most girls don't like that fat that sits here. That's $300. And then the bikini is $300. All right. Then it goes on to tell you how to make your recovery house reservation. I'm not gonna read all that. Alrighty. And here are the extra expenses. Oh, one thing. Our clinic does not accept several deposits to pay your surgery in advance. So the only deposit they accept is that $500, which I sent using Western Union. And because my bank had closed and I had to send it prior to me going. Everything was like a rush thing with me. So I paid the deposit via Western Union. And that deposit is deducted from your total balance of your surgery. So the clinic only accepts credit cards with a 3 to 5% extra charge or US dollars in cash. So be mindful of that. You're going to be traveling to this country with a lot of cash. And it's not safe. And I'll talk to you guys about that in another video. So it says here, if you'll pay with a debit card, you have to arrive 5 days in advance. Because they only allow you to use $1,999 swipe per day in US dollars. And the total has to be paid at least 2 days before surgery. All right, so extra expenses. You're going to have to pay $150 health insurance, which is mandatory. $140 for your second stage garment, your FAJA. $200 extra days at the clinic. Now that's not mandatory. That's if something happens. God forbid. And then you have $100 lungs doctor evaluation, which is mandatory. All right, then they give you the information on the airport. In this letter, in this quote, she says, I recommend my patients to stay here at least 15 to 18 days. The minimum is 10 days. If the patient cannot stay the minimum days requested, he or she will assume the risk of blood clots, seromas, and fluid accumulations, leaving with the drainage in case of tummy tuck, wound, and infections and several pain. I don't know. Okay, so she gives you the hemoglobin levels, and it actually isn't on this first quote, but for the BMI, the limit is 35. My BMI was a 30. It was probably a little less than that before I went to surgery because I actually lost 10 pounds before I went, so I think it was less than that. But when I sent her my information, it was a 30. Then it just goes over what your quote includes. And that includes a private nurse if you come by yourself. If you come with a companion, the quote wouldn't be less. So it's the same. You get a patient coordinator, and my patient coordinator was excellent. I still text her to this day. Her name was Muriel, and she's really good there. She helped with everything. Then you get medical staff, which includes your surgeon, which is Tania Medina, the helpers, the nurses, the medical care, post-surgical, and anesthesiology, the surgery room, the surgical equipment, waste materials room. And then it also goes on to talk about the disposables, the drugs, the recovery room. And then you get the room for 24 hours. Any extra days, like I said, was $200. They monitor and cures post-op. And one post-op garment, which is a stage 1 garment. Then you get your labs, which is your CBC, and then they test your urine and all of that jazz. And then you get a cardiovascular evaluation, your EKG. And you get an x-ray. I don't remember. Oh yeah, I did get an x-ray. I did. I'm lying. I got that the day before surgery. All right. So this was everything. The price is in American dollars. The administrative process and balance of fees is due 48 hours prior to your surgery. And to book a surgery date, you have to make that $500 deposit. So she goes over that part again. And this price is good for only 3 months. So that's why I ended up having to get another quote. So this was from 2017. Alrighty. Okay. So this is a lot of like things telling you what you need to do before you get there. I'm not going to go over all of that because right now we're just going over price and how to get your quote. Okay, so I reached back out to Medina today, January the 22nd. I reached back out to her and everything looks totally different. Like she has her nice little logo there and everything now. So she done upgraded, y'all. But anyway, she goes over, she said, it's very important that you take into account the following before planning your surgery. You have to be between the age of 18 and 50 years old. Your body mass index limit is 33. So 2 years prior to this, you could be up to 35 for your BMI. She's down to a 33 now. Okay. It says your hemoglobin levels must be greater than 12 for 1 procedure, more than 13 for 2 procedures, and more than 14 for 3 procedures. Make sure you read this stuff, y'all, because I got tummy tuck, lipo, BBL, muscle repair, and I was a 12. Okay, we're not going to talk about that. So if you suffer from any health conditions that should be taken into account, please notify me as soon as possible. I have severe anemia, and I did go over that with her prior to even coming to the Dominican Republic. Make sure you tell the honest God truth about everything because you do not know what can happen. You don't want to risk anything. Okay? And the things that they accept to perform procedures, they accept those with asthma, thyroid, diabetes, hypertension, because those can be controlled. All right, and you have to stop smoking for 6 months. I don't smoke, so I was good on that part. Now, see how back then she didn't talk about none of this. So take into account that you must stay 30 days in the country for follow-up and control visits. I guess after so much going on in Dominican Republic, she has changed a lot of things. So she did mention in this quote that she wanted, she advised that we stay in Dominican Republic for 30 days. And I know I had someone question me about that on Facebook. When I reached out to her, I told her that I was, what is the minimum days to stay and did I have to stay 30 days? She said I didn't have to stay 30 days, but that's what she advised. Okay, so she went on again to say that I needed liposuction on my abdomen, waist, lower, and upper back, both flanks, with or without lipo injection to the buttock. The price is the same. Tummy tuck with muscle repair. So all of those procedures remained the same, and the price went up, guys. The price in 2019, well, because it's tax time, I'm not sure. The price is $4,800 instead of $4,500, which wasn't bad. So. And then the recovery house price went up. You get all the same things with the recovery house, but for 10 nights, it's $85 per night now. And then it would have been an additional $65 per night for my guest, which was my husband. So we decided to do an Airbnb, which was way cheaper. I kind of really wish I had did the recovery house because of all that it included. I needed that 24/7 nurse. I needed all of my meals and things of that nature. But I think I kind of went with the Airbnb because I wanted to be like in a more private zone to recover. I know me, like I get irritated and I'm a crybaby. I just didn't want to be around a lot of people. So I chose that way. But anywho, 2017, the price was $75 per night, and now it's gone up to $85 per night, which is the total price of $850. The transportation includes the airport pickup, medical checkup, bring you back to the airport. That has gone up as well. It's now $150, which brings the total price to $5,800. Any extra areas is still $300. Your extra expenses for the health insurance, I believe back then it was $150. It's $200 mandatory. Your second stage FAJA is still $140. Extra days at the clinic is $200, $65 per night and per person in recovery house for an additional guest, which I just went over. $120 per night in private rooms in the recovery house, which I wanted to do. If I hadn't gone with my husband, I may have done that private room. And then it's $600 for the blood transfusion deposit. That's for 3 bags. I used 2 bags, so I did get $200 of those dollars back. But at your pre-op appointment, you're going to pay the $600 deposit. So be aware of that. You pay $100 for your Doppler. This evaluation includes an ultrasound scan of the legs to make sure there are no blood clots before surgery and before going home. Now, I don't remember getting that test before going home, so I'm just letting y'all know. All right, so if you're getting an abdominoplasty with muscle repair, you have to be evaluated by a pulmonologist, and that is $100. And I did get that test. It says if you suffer from diabetes or if you suffered during pregnancy, you had thyroids, you should be evaluated by endocrinologist. The cost of this evaluation is $300. I didn't have that expense. Each of the massages costs $30 extra, and you need a minimum of 10 lymphatic drainage massages after surgery. I paid $25. I didn't see this $30, so I paid $25 per massage, and I feel bad now because I'm just reading this and I owe somebody money. All right, and then she goes on to list the medicines that you're going to need. I'm not going to go over all of that, but the estimated cost of the medicines is $400. And then it's rules of the recovery house. And what's included in your quote is the same. It's going to be your private nurse if you come along, your patient coordinator, your medical staff, surgery room, surgical team, waste materials, anesthesiologist, disposable medication and recovery room. You get your room for 24 hours. Everything is still the same from the first quote. Your deposit, the deposit and everything is still the same. The price is guaranteed for 3 months. All of that is still the same. So that is my quote, guys, and that's how much it costs. But I'm going to go over how much I spent. I have it in my book here. I'm going to be looking down to read this information to y'all. All right, here we go. These were my expenses. So the surgery was $4,800. Insurance was $150, which was mandatory. Massage, $25 each. And I'm going to tag in my description how many massages I got, because I thought I wrote it here. But the massages were $25 each. The lung test was $100. The Doppler test was $100. The deposit I put down for the blood was $600. I used 2 bags, so that was $400. The medicine, I spent $280. My flight was $350 round trip. The Airbnb was $299. That was a steal. My driver, I paid $160. The nurse was $170. And I also paid her a $50 deposit. The food was $300. We went to the grocery store maybe 3 times. My passport was $209 because I did it at the last minute. Oh, I spent a total of, no, when I came home, my bad. I came home on a Friday. By Sunday, I hadn't gotten a massage since the Thursday. I came home Friday. Sunday, I was so swollen and could barely move. You could barely touch me. So I had a nurse who was also a masseuse to come over and give me a massage. And since I live far in Atlanta, I live far outside of the perimeter in Atlanta, she charged me $165. That was an expense. And then I also have a massage therapist that comes here every other day, and she does 10 massages for $610. Okay, so my camera is rude. It cut off. It says something about an internal temperature. It's not hot down here or anything, but anyway. Massage Genie for 10 massages is $610, and I paid a deposit of $325. I will put her information in my description box as well. I also ordered a contour FAJA which hasn't arrived yet. The consult for that was $29.99 for the coordinator to come out and measure me so I can have a custom FAJA, and the contour FAJA was $150. I also ordered a stage 2 FAJA from Amazon because the one that I got from Dominican Republic did not fit my thighs, and that's this stage 2 FAJA that I have on right now, and this one was $72. So far, that is all my expenses. I will put the total in the description box of what I spent, you guys, and I just want to let you guys know, when you decide that you're going to have surgery in the Dominican Republic, don't just look at the price of the surgery. Be prepared for anything to happen. Like I just went over that quote. Anything can happen. You can end up staying 2 to 3 extra nights in the clinic, and that's $600. Be prepared to put a deposit down on blood, because some dolls will come and think, oh, I'm healthy, I'm not going to have that problem. You never know. And then if you didn't pay for the blood, you can't get mad if you don't get the blood while you're in that hospital, and you could bleed out or anything can happen. Me, I was unconscious, in and out of consciousness, and throwing up uncontrollably with nothing on my stomach. And the only thing that brought me back to being okay was the blood. I needed that blood. And I also got iron infusion, and still came home with my hemoglobin being a 10. So you have to really, 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 really be prepared to put that money out there. Don't go to DR with only the $4,800 for your surgery and maybe $1,000 extra. That's not enough. When I say I cashed out, I'm going to put the total in here in that description box, because I didn't add it up, and I felt like I was prepared for this video, but whatever. I kind of didn't have that total written down because I'm still adding to my list, because your post-op care, very important. I'm still adding to my list of everything I spent. That $610 for the massage, that's not it. Today, I'm going to get manual drainage at another masseuse's home, and that is $50. Like, be prepared, have a budget set aside for this. Save, because you don't want to get into a situation where you're stuck in the Dominican Republic, you don't have enough money, or your life is on the line and you don't have enough money, okay? I'm just saying. Well, before I end the video, I forgot to go over, once I paid my deposit and I got my confirmation from Medina, my surgery was reserved for March the 5th. However, Spirit Airlines did some crappy stuff, and I ended up not getting my surgery till the 6th, which was good because March the 5th was my anniversary, my husband and I's anniversary, so we got a chance to not have me all cut up and stuff like that on March 5th. So she said the date can be pushed a day in case of a delay with the labs or any issues. So I didn't see that, but that was good because I did have a delay. She just goes over to make sure you remember to take your iron, which is 325 milligrams, at least 4 weeks prior to surgery. And then it says you have to be in the Dominican Republic 48 hours before surgery to decrease the clots in your legs. And that was what really was bugging me, because Spirit kept screwing up my reservation, and I felt like I wasn't going to get there in time. And then she tells you the airport you're flying into is Las Americas International Airport in Santo Domingo. Your pre-op, the arrival at the clinic, my pre-op was that next morning at 10 a.m. You must be to the clinic on time. And y'all, it was so many people there. When I say it made me nervous, because I'm like, how is she going to handle all of these surgeries and stuff like that? But I was nervous about that. There was so many people there. It also says that an adult must accompany you to sign the consent for surgery in case you are from another country. This is not necessary. But if you are from Santo Domingo, in case you are from there, they make you bring an adult with you. And for administrative reasons, they say you must pay the full amount of the procedure before surgery, which I went over in that part. Post-op, they say you must be accompanied, if possible, by a family during or after your procedure. Even though they say if you aren't, if you're from there, that's only for them. I feel like everybody should go there with some type of support. Like, I know everybody don't have a support system and have anybody that can actually take off that much time or take that much time out of their life to take and go with you to Dominican Republic. But I feel like it's very important. You're going to need that support system. Literally, I was losing it. Literally. When they wouldn't let my husband into the recovery room with me at the clinic because my nurse was there, I freaked out. Like, because I was freaking out. Like, I couldn't understand, like, let him in because everything that was going on with me, I felt like he should have been there, but everything turned out okay. All right, so it's just telling you what to do the night before surgery. You eat something soft the night before. Do not eat or drink anything after 10. Not even water. That's the normal jazz when you're going to have a procedure the following morning. Do not take any medicine unless you're prescribed by your doctor. Shower the night before the procedure, and they have a special soap that you need to use, and I'll tag that in the description. You can't have any nails on your hands or feet. And then it just goes over the morning of surgery, dress casual and your loose stuff, no valuables, no jewelry, brush your teeth, do not swallow the water, do not eat or drink anything. Do not swallow the water, period. I don't care if it's the night before surgery. The water that's coming out that sink in Dominican Republic, don't put that in your mouth. All right. And it just goes over the care after surgery. Before leaving the clinic, they give you verbal and written instructions, and I do have that stuff. It's a plan to be off work 15 to 21 days. So I see a lot of people go back to work and then they wonder why they have complications. Listen to these doctors. And they said, especially if your job involves heavy lifting or any strenuous activity. And that's pretty much it. So I gave you all the information I have. I'm going to put my total in the description box. And I'm going to keep updating my total as the months go on as to how much I spent. So keep checking my description box so you can see what I've been spending. I'm going to make sure that I give you all the raw and uncut and that you are ready for this journey. Because listen, I don't care how much of this stuff that I watched. I watched YouTube. I watched the people on Instagram. I'm in every group on Facebook. And I don't think any of that prepared me. So I'm trying to make sure you guys are ready. Anywho, don't forget to like, comment, subscribe. Send me a private message. Tell your mama, tell your daughter, tell your friend, tell your baby mama if they trying to get snatched. And again, this is me, y'all. This is me, day 18 post-op. This is not swelling. This is the post pads that I have here on my tummy tuck scar. And for some reason, it is burning right now, but smooches.